For the best possible results, how far would you travel? Would you take an international flight to find a hospital that ranked among the very best in the world for the treatment of heart attacks? For the best possible results in 9 cardiac care measures, just how far would you go? St. Tammany Parish Hospital, world-class healthcare, close to home.
Welcome to Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Amanda Paxton. Today we have 3 guests here to talk about women's health, including breast health and pelvic floor therapy. Our first guest is Dr. Jennifer Daly, a breast fellowship-trained radiologist from the Women's Pavilion, as well as the medical director. Welcome, Dr. Daly.
Thank you for having me.
So first, can you give us a little bit about your background and your training?
Well, I went to medical school in Vermont, and then I went back to California and did my residency in radiology at the University of California, Irvine, and then I did a fellowship at the University of Southern California to specialize in breast imaging.
Okay.
I've been doing it for about 8 years now.
Okay. So I guess the first thing that most people think is, oh, I don't have a family history. I don't need to worry about getting a mammogram. Can you talk a little bit about that?
Yes, that is a big misconception, actually. A lot of people think they'll never get it because, yeah, they don't have a family history. But the actual reality is 75% of the people we diagnose with breast cancer have no family history.
Oh,
and,
wow.
Yeah, people do not know that. They think, oh, they think they'll never get it. But if only the people who had a family history got breast cancer, we would only screen those people.
Right.
But because 75% of people who don't have family history get breast cancer, then we screen everybody. So I consider everybody high risk.
Okay. And I mean, you would think that way less people would get it if it was only people with a family history.
Right.
Okay, and so what are some of the signs of breast cancer? I know, you every now and then you get a pain or something like that. Is that something that people should be concerned about?
People come in all the time for breast pain. I'm really glad you asked. But usually breast pain is not a sign of breast cancer.
Okay.
But people come in all the time. Usually breast pain is due to hormonal changes or changes in your weight, or a lot of times people are not wearing a bra that is properly fitting. Maybe the bra is too tight, too loose, wrong cup size, they've gained or lost weight, they're still wearing their old bra. I mean, that can be painful, but it's not usually cancer.
Okay. And
but if you have a lump, then you need to come and get that checked.
Are there any other signs besides having a lump?
A lump, or if you have clear or bloody nipple discharge, those are usually the signs. Otherwise, we usually try to catch breast cancer early before you're symptomatic.
Okay.
That's why we recommend screening mammograms every year.
Gotcha. Okay. And so what does it mean when someone has dense breasts?
Okay, so breast density has been a very hot topic in mammography recently. So when we look at a patient's mammogram, we had to judge the density. Everyone has a different composition of fat versus fibroglandular tissue, different compositions. Some people have more fat, so they're less dense. Some people have more fibroglandular tissue, which is the milk ducts and glands, which makes them more dense. This is important because it's the milk glands and ducts that can make the breast cancer. Okay. So if you are denser, you have more of that tissue, and your mammogram is harder to read because that's more white tissue and the cancers are white. So you're looking for white on white. You're looking for like a polar bear in a snowstorm.
Oh, wow.
So people think mammography is 100%. And we try so hard to catch every cancer. But the reality of it is, depending on your breast density, the sensitivity of detecting breast cancer varies. In a non-dense breast, it can be like 70%. But in a very dense breast, it's like 50%. Which means we could be missing like 50% of breast cancers if your breast is so dense and we just can't see the tumors.
Okay. Is there something y'all recommend if somebody does have dense breasts that can help with that?
Yes. So we have additional screening that we can do, such as screening breast ultrasound, where we can take a probe and use sound waves and look for tumors in addition to the mammogram, and also screening breast MRI. MRI is a really great test. That is 93% sensitive for detecting breast cancer, so it catches almost all of them.
Okay.
But not everybody can get an MRI. Some people are claustrophobic, some people have a pacemaker, some people have metal in their body, they can't do it. But if you can get an MRI and you're considered high risk, then it's a good idea to get one.
Okay. And so do most people just get that if they have dense tissue, or is that something that people can get?
Well, it's the breast MRI is additional testing. We still recommend the mammogram. If you have dense breast tissue, or if you are considered high risk, you can qualify for an MRI.
Okay.
To qualify for high risk, we have this whole risk assessment system when you come for a mammogram. We look at the patient's age, family history, whether they have a mother, sister, or daughter with breast cancer, how old they were when they started having their periods, how old they were when they started having menopause, how many children they've had. It's this whole line of questions, and they calculate it out, and it determines your lifetime risk of developing breast cancer. Most people, it's like 12%. It's the average population. It means 1 in 8 women will get breast cancer.
Okay.
That's how you get that 12%. Now, if they calculate it and your risk is higher than 20%, then your insurance should pay for a screening breast MRI.
Okay. And is that yearly as well?
They do recommend yearly. So, I mean, it still means 80% chance that you won't get breast cancer.
Right, right.
So, but we can catch it earlier for those people who do have a high risk.
Okay. And something that most people probably don't think about, do patients that have breast implants, is that something they still need to get mammograms for?
Yes, that is a question that comes up all the time. So breast implants are more common than people realize. We see them all the time. And people with implants are worried that we might rupture them or we might be uncomfortable. So when they do come for a mammogram, we do have to do extra pictures. We take pictures with the implant in place, and we push the implant back, and we take pictures in front. But it is still important to get imaging, because just having implants doesn't prevent breast cancer.
Right.
You can still get it, and we still want to catch it early.
Right, and it's still safe to get an mammogram.
Yes.
I think that would be the biggest concern.
Oh yes, we do them all the time, every day. We do not rupture implants.
Okay.
So we're very good. We have very good techs.
Okay. Well, great. Well, thank you so much for being here. And is there anything else that you wanted to tell us about mammograms or breast cancer?
Just come on in. Every woman over the age of 40 should be coming every year for a mammogram.
Okay.
If we catch it early, we can treat it, and hopefully we can cure it.
Perfect. Well, thank you so much for being here. I'd like to thank Dr. Daly for being here, give us that great information about mammograms and breast cancer. Up next, we have Cindy Turner, a registered nurse at the Women's Pavilion.
The North Shore. It's our place, where finer things are sometimes the simple ones. Social, sweet, and spirited, but always in harmony. Around here, life is about great things coming together. St. Tammany Parish Hospital and Ochsner, collaborating in the name of community.
Welcome back to Healthy Living, brought to you by St. Tammany Parish Hospital. Our next guest is Cindy Turner, a registered nurse and breast navigator at the Women's Pavilion. Welcome, Cindy.
Thank you.
Can you first tell us a little bit about your background?
Yes, I've been a nurse for 28 years, and I started off in labor and delivery. I've been with St. Tammany for 23 years now, and I've been in the field of breast radiology or breast imaging for about 10 years. I really enjoy it.
Awesome.
Thanks.
Okay. So what is the difference between a screening mammogram and a diagnostic mammogram? Because I know, at least for me, you assume they're all the same.
Right, and we do get that a lot. A screening mammogram is something that we advise women who are over the age of 40 or 40 and over, and also sometimes a little bit younger if they have maybe a family history or some risk factors. But a screening mammogram is the imaging that they do for a patient who's not having any symptoms and just needs to come in for a yearly exam so that we can try to get imaging and look for breast cancers at their very earliest stages. Usually those are covered by their insurance 100%, so it's really a benefit to the patient to come in, and it's usually not an out-of-pocket expense. If we find something abnormal on the screening mammogram, so the radiologist reads her images, finds something on there that she needs more information on, then we call them back for a diagnostic mammogram. Or if the patient has a symptom at home and they, for instance, had a screening mammogram 2 or 3 months ago and it was normal, but this morning she woke up and felt a lump, then we would be recommending a diagnostic mammogram. And I try to call that a problem-solving mammogram for our patients so they understand we're trying to figure out what's going on and give a diagnosis to it, and that's the radiologist's job, is to try to help the patient figure out what's going on and see whatever further treatment might be needed.
Okay, and is there a difference in how these mammograms are performed?
They'll feel very similar to the patient, but
Okay.
there are differences. So for the person who's standing at the mammogram machine, it may seem like she's just doing some different angles, some different views. They still use compression. And the difference is, though, the radiologist will be looking at those images right then and there. So the patient waits, and then if any further imaging, like an ultrasound is needed, we'll do that as well.
Okay.
And then she would explain the results to her before she leaves.
Gotcha. Okay. So for, I guess for a regular screening mammogram, what's kind of the procedure once the mammogram takes place?
Okay, once that takes place, usually it's about a 15 to 20 minute appointment. Patient can dress and leave, and the radiologist will read those as they kind of happen. We'll have a work queue that they work on. Usually they're read within 2 or 3 days. And then the resulting report goes to her ordering doctor, and a copy also goes to the patient. We're one of the only imaging tests that is required by law to send results to the patient in the form of a written communication. So that goes in a letter explaining the result and also an actual copy of their report.
Okay. And then does anyone get a call back, or is that only if you need further testing?
Yes, if further testing is required, we don't call the normal results typically. Patients are always welcome to call if they have questions about it, and we're happy to answer those. But if there's an abnormal finding, we usually try to give the doctor's office, a little bit of room to call their patient and advise them. If we don't see the patient scheduled within a few days, then we call them as well, just to make sure they got the letter or they got a phone call, and try to get them scheduled and do whatever we can to help facilitate that.
Okay. And I know you don't need a physician referral now for a screening mammogram, correct?
That is correct. The law does allow for women to be self-referred. We do try to encourage patients, however, to have a relationship with either their primary care or their OBGYN or other doctor, because if an abnormality is found, then we do have to get them connected with that provider so we can get further testing done.
Okay. So they don't have to have a physician referral, but you encourage them to have a primary care or someone.
It's always a good idea if possible, but it certainly wouldn't stop us from being able to take care of them.
Okay. And then I know something probably everyone has heard about a mammogram being painful. Is it something that can be avoided with a different type of test? Or is it something that, is it less painful than most people think? It's just kind of, old wives' tale.
Yeah, we hear that.
horrible.
We do. I get a lot of phone calls. Women are worried. I know Dr. Daly has touched on the fact that implants, too, sometimes women are afraid of it hurting. But the truth is, it is a very delicate technique. Our techs are very careful to try to help patients be as comfortable as they can. There is some compression involved. But some women truly have more painful breasts than others, hormonal changes that can happen. So we encourage, if I have a patient that calls me concerned, I tell them they're okay to take a little anti-inflammatory over the counter before they come. Try to schedule it around their cycle in a way that at a time when they know their breasts are less sore and painful. And always to tell the tech what she's experiencing, because they'll try very hard to make it as comfortable as they can. But nothing really takes the place of a mammogram. The mammogram looks at structures in the breast and finds those very, very early breast cancers that other techniques may or may not catch, things like calcifications that are not seen with ultrasound. So when a patient wants to try to substitute an ultrasound, for instance, instead of a mammogram, I'd really try to encourage them to have both if needed, so that we don't skip and miss that important part either that can happen in the imaging. We don't want to miss it.
Okay. And then I think Dr. Daly touched a little bit on this, the ultrasound and the MRI are kind of something you would get further testing if something's found.
Exactly. I mean, ultrasound can see some structures very well, like cysts and nodules, and sometimes it's appropriate. And for instance, someone who is very young and may be so dense that the mammogram may not be helpful yet, for instance, in a 20-year-old or something who might have a lump, they will usually start with an ultrasound, because those types of structures can be seen very well with ultrasound. So it definitely has a place, and the MRI, of course, can be extremely helpful, and if they need that more intense imaging.
Perfect. Well, thank you so much for being here. I
Thank
appreciate the
you.
great information. I'd like to thank Cindy for being here with us. Up next, we have Jenny Porter, a pelvic floor therapist.
Thank you. Thanks. Thank you. Thanks for Sunny Face Eggs for my baby sister.
For my fishing buddy.
Thanks for my mama's gumbo. Thanks for my mom.
We enjoy receiving awards and recognition from our peers, but the true reward comes from seeing positive outcomes for our friends and neighbors. So thank you for trusting us. St. Tammany Parish Hospital, world-class healthcare, close to home.
Welcome back to Healthy Living, brought to you by St. Tammany Parish Hospital. Today we're talking about women's health, and our next guest is Jenny Porter, a pelvic floor physical therapist. Welcome, Jenny.
Thank you.
Can you first tell us a little bit about your background?
Sure. So I am a physical therapist first. I did my training in Missouri, which is where I'm from, actually. And then after completing physical therapy school, I went on to get my specialty in pelvic floor treatment as well as pregnancy and postpartum care. So I have like a dual certification beyond my physical therapy degree.
Okay, great. So what most people would probably want to know is, what is pelvic floor physical therapy?
Absolutely, because there's not many of us, so
Right.
there's not much that people hear about it. So we are physical therapists that have specialized in pelvic health. So it's the structures and the tissues within and surrounding the pelvis. And so, like I said, it is all extra certifications and studies beyond the physical therapy degree that us as specialists that we have.
Okay, and for anyone who may not know, what exactly is the pelvis?
Yes.
And for some people might not, don't know the terms or things like that.
Absolutely. So you have your spine, which then goes down to your hips. So your pelvis is like that whole middle part of you, kind of like below your belly button, above your thighs, and it wraps front to back. And so there's quite a few bony structures. And then you have the muscles that form like a bowl along the entire bottom of the pelvis. And those are called your pelvic floor muscles. And they literally support all of the contents of the pelvis and the abdomen by these muscles. And then we also have the organs within the pelvis. So your bladder, if you're a woman, your uterus, rectum, vagina, those kinds of things. So we can kind of look at those structures from a tissue standpoint, muscles, fascia, and then also looking at it in alignment, and then the function of organs as well.
Okay. So what reasons would someone need to see a pelvic floor therapist?
So we can look at some of what the physical therapy classics are. So if you have weakness of your pelvic floor or pain of your pelvis, any bladder issues, so urine incontinence, difficulty emptying your bladder, bladder pain, any bowel issues, so constipation, fecal incontinence, poor emptying of your bowels, and then pain syndromes as well. So pelvic pain as a whole, pain with intercourse, pain with examinations, and pain with tampon use, things like that we can also help with.
Okay, and so who would need to see a pelvic floor? Like, is that something that anybody can see, or?
Yes, so we do specialize with this for men, women, and children. So the diagnostic, the way we go about exploring the diagnoses of them vary based on your gender and your age, if we're dealing with an adult versus a child, a man versus a woman, and then the treatments that we can do vary based on what we find from that exam.
Okay. And something I know that y'all work a lot with is cancer patients. Can you tell me a little bit about that and how that pelvic floor therapy helps with cancer?
Absolutely. So through our specialty, we do get a little bit broader knowledge of cancers and their treatment options, and therefore we can correlate that with how it impacts the pelvic floor muscles and structures of the pelvis as a whole. A little bit more so as a pelvic floor therapist than in other physical therapists in general.
Okay.
So some of your cancers will have a direct impact on the pelvic floor. For example, any urogenital cancer can, it's in the same area, can have a direct impact on the muscles and their function. And then the treatments for cancers can also impact the pelvic floor muscles. So it can cause a change in hormones in your body, and your pelvic floor muscles are very reliant on hormones for their natural integrity and their function. So we can help manage some of those changes that are happening and offer some more direct education to the patient about what's going on outside of their cancer treatment that might be affecting their whole body and their pelvis specifically.
Okay, and is that something that they would get during treatment, after treatment? When kind of would they get that therapy?
Yes, so they can come at any time. You know, if they just got diagnosed with cancer and they're trying to figure out what they want to do, and in the meantime they're kind of having some problems, come to us. Or if you're halfway through your treatment and these new problems are developing, or if you are a cancer survivor and you're trying just to get back to your normal life and things just aren't coming back as quickly as you thought they would, or you're still having these lingering issues, come on in, we'd love to help you. Physical therapy as a whole can help with some of the general symptoms, so like fatigue, overall weakness, balance deficits. If you've had surgery, we can help with scar management, stretches, swelling and lymphedema. And then pelvic floor specifically, we can help with the bladder issues and the bowel issues I kind of talked about, but also probably the most problematic that no one ever talks about is sexual health. And so if you're having issues, pain with intercourse, low libido, pain or difficulty with arousal, we can help kind of work through and navigate those issues as well.
Okay, and is this something that you should talk to your physician about first, or is it self-refer, and what type, how would you get this sort of treatment?
You can definitely self-refer. So in the state of Louisiana, legally, you can come to us without a referral, which is wonderful for access. However, that does not guarantee your insurance will pay for it.
Right.
Typically, insurance is still requiring a physician order for them to cover the services. So we always recommend go to the physician first. Then they will also help navigate through if there's anything medically they want to clear or screen first.
Right.
That'll get cleared. And if they order more testing, that only aids us in our treatment once you come to us. But either way, we're here, either with the referral or without it.
Right, but it's something you should, if you're with any issues, you know, it's always good to talk to your physician and kind
Absolutely.
of work on an entire treatment plan.
Yes, and we're a team. You know, the whole
Right.
medical field, we're all here to work as a team, from the physicians to the other medical specialists to then us as physical therapists and the specialist as a pelvic floor therapist. We all want to work together just for the health of that patient.
Perfect. Well, thank you so much for being here, and that's, you know, great information that I think most people don't know that it even exists. So I appreciate you being here and sharing that with us.
Thank you for having me.
Thank you to Jenny, Dr. Daly, and Cindy for being here and sharing this great information about women's health. This has been Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Amanda Paxton, and we'll see you next time.